Hello, my name is Rhonda Dickman. I'm a registered nurse and clinical quality improvement specialist with the Tennessee Hospital Association. I lead THA's efforts to support hospitals in their mortality reduction efforts. And today I'm pleased to share a hospital spotlight from Cookeville Regional Medical Center. Cookeville Regional Medical Center is a 247-bed hospital in Cookeville, Tennessee that sees over 49,000 patients in their emergency room each year and has over 13,000 inpatient admissions each year. They're recognized nationally for their quality in patient care, and they were the first hospital in Tennessee to achieve Joint Commission specialty certification for sepsis, along with their other specialty certifications and accreditations. Today, to talk about Cookeville Regional Medical Center's sepsis program is their ICU clinical nurse specialist, Angela Craig. Angela?
Hi, Rhonda. Thank you so much for giving me this opportunity. And I'd just like to share with you some of our sepsis highlights from our Cookeville Regional Medical Center. Being sepsis disease specific certified has really helped us continually keep our momentum and moving forward with this sepsis patient population. So even though this is a lot of work, this has helped us constantly look at our patient population, how they're doing, and how we can better serve them. We rolled out our sepsis initiative many years ago, and we used a 4-tier process for implementation. And it was very specific. And you can see that on the base, it states organizational consensus that severe sepsis must be managed early and aggressively. So really having your leadership embrace that it's really important to focus on this patient population, and then develop all your screening tools and your trigger cards, etc., and then implement that sepsis bundle and then measure success. One of the items that we have developed has had multiple different looks, and this is our latest one, is our pathway. And this is our severe sepsis and septic shock clinical pathway. And basically we worked with our team from the emergency department as well as the ICU to make sure that this made sense as they're filling this out and that it wasn't too cumbersome. But the whole idea behind a pathway is that it really helps guide the direction of care of your patient. So if you know your patient has severe sepsis or septic shock, by filling this out, it will help guide your care on when to get what lab and what are the items we need to do for these patients. Another little aspect of this pathway is our stroke volume optimization section over in the bottom right there as you're looking at it. And if I were to add anything to this, which with the next rendition I will be adding, is this patient hypotensive or hypoperfused? If so, we really want to think about monitoring that stroke volume, giving either a fluid challenge or doing a passive leg raise, and then seeing if their stroke volume increases greater than 10%. And the thought is if it does, then that patient can tolerate volume. However, if we don't see a greater than 10% increase, then maybe fluid is not what that patient needs. And so really tailoring fluid specifically to each individual patient is really important in this patient population, and especially now as we're dealing with COVID as well. Another thing we've developed is a progress note, and this is our severe sepsis and septic shock progress note, and it looks very busy, but what I want to say about this is it basically will help the provider make sure they get all the elements they need in order to meet the requirements for CMS. Now, it's not just about meeting CMS requirements, it's really about the patient. But you can see here that if we have a document that will help guide the provider, I think that can be beneficial. Now, we not only have this on paper, we have this electronic as well, so the providers can fill all of this information out electronically as well. We also have orange sepsis folders around our hospital on all the units and in our emergency department, and these are available and they basically will help you as you care for your patient with sepsis. Now, in that folder, we have the pathway. We also have the progress note that we just discussed. We also have education for patients and family, and this one is life after sepsis. And so this is what we're really trying to keep everything bundled all together so that everything can be easy for the nurse when they're caring for that sepsis patient. We've also developed Code Sepsis. Now, Code Sepsis activation can be done by the nurse. It does not have to be done by a provider. And basically what will happen is when that nurse activates that emergency call, she's going to get a team of people to come up there and be with her and be with her patient and help her care for that patient and get that 3-hour bundle done very quickly. So I think this is just another layer of support for our nurses and support for the patients, more importantly, for them to get what they need done in a timely manner. One area that's very exciting is we had an EMS sepsis rollout. And what we did was we worked with our Putnam County EMS department and literally went through and developed a sepsis protocol for them. So they are able in the field to declare a code sepsis, to notify the hospital. They can get blood cultures in the field. They can give fluid boluses. They can give antibiotics. And they have very clear guidelines. They can start vasopressors, all of those things, and then be able to relay that to us in the hospital. So we're ready for that sepsis patient when they arrive. We also have developed a pediatric and neonatal screening for sepsis. Now that is done in our emergency department. And basically what this will do is help the nurses be able to identify with that neonatal or pediatric patient if there is a high risk for them to possibly be septic, and to communicate that to the provider so that we can best care for our neonatal and pediatric patients as well. We also every September have a big celebration in our hospital, and we call it Sepsis September across the country. People do fun things around this time, and these are just a few of our pictures of things that we've done. We make popcorn. We have gave out ice cream one year. This year a little more challenging with COVID, but we literally were able to go floor to floor and give out bags of goodies and really encourage the staff to keep up the good work they're doing. On this right side, this picture is one thing we do for community education. Going to fairs is a great way that we can really try to teach the community about what sepsis is. And another part about Sepsis September, I consider that as community education as well, because we're trying to educate every person in our hospital who works there, whether it's nursing or non-nursing, what sepsis is and what they can do to prevent it. And one of our last things that I cannot reiterate enough as being so important is constantly measuring your success. And what you're going to see here is all the items that we literally monitor every month at our hospital to determine, is there an area of opportunity for us? Is there something we could do better? But we look at that 3-hour bundle, the 6-hour bundle. What is our survival rate? What is our readmission rate? Where are we at with compliance with all these tools that we've developed? And another thing we really focus on is time to antibiotic. How quickly are we giving our patients their antibiotics? So it is so important that we are measuring our outcomes so that we can determine what areas do we need to work on so we continually move forward and do better care for our patients. And lastly, I just want to mention the International Sepsis Guidelines. I'm a firm believer that guidelines help us in determining what our protocol should say. They help us with the evidence to support our practice. So here is just a list of our International Sepsis Guidelines, and the new one should be out in 2021. I'm looking forward to seeing if there are any changes, and at that moment, then we'll have to go back through all the protocols and make any changes that are appropriate. And that's what we do. We constantly change for what is best for our patients. So if you have any questions, you can feel free to reach out to Rhonda Dickman, and I'm going to hand it back over to her.
Thank you, Angela, so much for sharing some of the successes and the practices that you have at Cookeville with your sepsis program. If anyone has questions, they can reach me at area code 615-401-7404. Thank you.